If you are trying to conceive mother, I want you to listen to this video and watch out for these signs, because sometimes you are pregnant but you do not know that you are pregnant. That is why I always advise every TTC mother to make sure that you know your cycle, to make sure you know when your egg release. That is only when you will observe these things that I'm going to be discussing about, which is signs of implantation. With this, I welcome you all. As soon as you click to watch this video, endeavor to share and subscribe to support us. If you are watching from Facebook, and recommend this page, God will bless you. I want to put a disclaimer that myself, Tochi, I am not a medical practitioner. You guys know that. I am a researcher, and after conducting research about fertility, I created this platform to inform, educate, sanitize women that are trying to conceive. Please do not use my teaching to replace your doctor's prescription, and do not use my content as basic for any patient treatment. I do not have right to prescribe. So, what is implantation? Implantation occurs after an embryo, that is fertilized egg, travels down the fallopian tube and buries itself deep into the lining of the uterus, where it will remain until delivery. And when do this implantation happens? It happens after your egg have been released, which means you must know the day your egg is released for you to observe, for you to know this. If you don't know your cycle length, if you don't know when you are releasing egg, which you guys call ovulation, this video is not for you. This is people who are seriously minded, who are calculative, who are observant, who are serious. You must know your cycle. I am not the one that will teach you your cycle, although I've done the video about this. It's not your doctor that will teach you how to calculate your cycle. Go to this Facebook. If you are watching me from Facebook, type. You will see fertility doctors that have done the video. If you are watching from TikTok, I think there are people who have done the video on how to calculate their cycle. Or better still, you can go to YouTube. Depending on where you are watching this video, the videos are there. All you require is just to pay attention. Watch it. You must not watch one video for you to understand. You must watch several videos. So don't watch one and you say, I don't understand, because people who do not really know how to split things down, by the time you watch 3 or 4 videos, you will get the person that explain it to your best of knowledge. So now this implantation occurs after your egg have been fertilized, which means there must be presence of ovulation. That is, the egg must be released. And the second stage is that your husband's semen must fertilize the egg. Now, after this, if the egg is fertilized, on the 4th day after ovulation, this fertilized embryo or zygote will start traveling down into your fallopian tube, where it is going to imbibe, attach itself in your uterine lining. So now what we are here to talk about is what will make me know, or how will I know when this zygote, zygote or embryo have attached successfully. Believe you me, when it is attaching, you must feel something. Although some of us, we don't pay attention to ourselves. So when it's happening, we might not obviously know. But if you are observant, you will notice. And some of the signs differ. It depends on the hands that baby wants to come with. I will share my experience with you. I always experience implantation bleeding whenever I become pregnant, but this my last baby, I did not experience it. You know, for me to confirm, I was waiting for it, but I didn't see it. It came in another way, which was back pain. So it's not a must. What I'm trying to emphasize here is this: it's not a must that if you do not see any of these signs, you'll be worried. No. Our body differs, our system differs. What worked out for me might not be what worked out for you. So you just need to be, observant for you to know when it happened. the first signs, according to researchers, said implantation bleeding, which is what I just said now. When the zygote imbibed or attached itself successfully, it will irritate the lining of the uterus, so there will be some spotting, like pink. It's not going to be red like your flow, no. Pinkish discharge or spotting. When you went to pee, you can see all those little this thing, and it doesn't last long. It can last for hours, it can last for days. But when it turns into the other one, bleeding, then it is no longer implantation bleeding. Another one is lower abnormal pain or bloating. You may experience it when the zygote is trying to attach itself. You might, experience mild abnormal bloating on the 6th or 7th day after the fertile period. So let's say if you ovulate today, you start calculating, maybe, or it starts from the 6th, 7th up to 12 days. Once it passed 12 days, any other thing you are seeing is your flow. Some may have another one. You may have pinkish discharge up to 3 days. If it is pink, as long as it's not flowing, it's spotting, or discharge, but it's not much, it is also a sign of implantation. Another one is fatigue and drowsiness. Sometimes you may be feeling tired and you want to sleep. It could be the sign. That is why I say it differs. It differs. So another one is sore and swallowing boob. I know a lot of people, when their flow want to come out, they always, feel boob hurt. And when their OV they want to release egg, they feel this. And now somebody is telling you again that you can feel. Yes, it's usual. All of them work together. So you might experience sore and swallowing. You understand? So now these things are happening to you, or if you observe the particular day that this thing happens, you give yourself a day or two, then go and buy pregnancy test and conduct test. You will notice that you have become pregnant if truly the zygote attach itself successfully. And again, it could be possible that you are pregnant or you were pregnant, but along the way, it might not implant successfully. And what can cause this? Stress, anxiety can also make you to, lose your pregnancy without knowing. Some call it chemical pregnancy. About 4 weeks after implantation, first symptom of pregnancy will normally begin to, emerge. So if you want to observe or notice this symptom that I just talked about, then you need to know your cycle. You need to, know the particular day that your egg release. So you start expecting when these things will be happening to you. You can say, oh, maybe I don't carry belly. Thank you so much for watching. Remember to share this video, and I pray that God Almighty in these last days of the year will bless you and grant you that which you solely, desire. Like I said, I am not a medical practitioner. Do not use my teaching to replace your doctor's prescription. Thank you so much.